at some point with the $39 trillion deficit, we're going to have to address it. And whether or not it's more and more inflation or making tough choices, which Congress has just not been willing to do.
Not willing to do. And I think whether it's education or healthcare, thinking reform and making massive reform, it's really hard. And unfortunately, we just spend more money doing it as opposed to thinking about how to do it more cheaply, inexpensively. And I think we're just not incented to do that right now, structurally.
So speaking of incentives, let's talk about the engine underneath all this. Is the core problem in American healthcare fundamentally a misaligned incentives problem? And if so, where does that misalignment run deepest?
If you think about the vast majority of spend, I mean, again, people like payers sit on top of the infrastructure. The max they can get in most cases like 15%. So say they add 15% of the overall cost. The rest is in providing care and devices and drugs, right? It's like that kind of simple. So if most of the cost is in providers, now drugs have gone from 10 to 20% in spend in the last decade. It's been, that is probably much of the inflation. But on the provider side, we pay people to do things, right? Fee for service drives the system, 100%. And we keep, talking about value-based care, but there's very, very little of it. And as long as you're paying people to do things and not for outcomes, we say there's like on a hospital website you're supposed to report, but nobody knows what the outcomes of their own providers are. It's 90% like word of mouth. And until we're paying for outcomes, like we're going to get the same thing. And until people are encouraged to, sort of be more efficient, it is my hope that we enable people to serve at the top of their license with AI, and that you just naturally, like we've invested in a NP, nurse practitioner provider network that we're going to be expanding across the US, and they can do so much. And primary care is so challenged that if you can just do that, like have NPs more accessible, more available, and empower them with AI and provide more information to them so they can do so much more, and leverage them and leverage primary care docs, to do more, better, then that should, instead of paying people more, the reality is hopefully they can do a lot more with what they have.
So as an investor, and when you look at the amount of money from private equity and venture that's gone into healthcare, has the venture and PE investment improved the system, or do you think it's distorted it?
I'm going to show my bias here.
Yeah, that's okay.
I feel like the venture community has, it really is about transformation. What we're trying to do, and like our mantra is, if something doesn't try to improve outcomes, access, lower costs, we're not investing in it. We just don't do that. And I think for most VCs, we're trying to tech enable things. We are trying to change things. We are trying to move to value-based care. So I think there is in general on the venture side, a like improvement transformation. Now you could argue how much have we improved in the last 20 years, but I do think with virtualization now we are, there are consumer models now. There is virtualization expanding access for systems that does make it cheaper at the end of the day. It creates more access.